All right. If you could slowly start settling down, that would be very nice. Thank you all for coming to the weirdest lecture hall that we could possibly find. We are very glad to see so many faces, new ones and familiar ones. We're so happy about the turnout at these events. So many people coming from all kinds of age groups and all kinds of cohorts. Today we welcome Dr. Helena Aicher, who will be holding a talk about ayahuasca and ayahuasca-inspired formulations. And I will give you a brief overview who Helena Aicher is before she can take the talk away. So Dr. Helena Aicher is a psychotherapist in training and a researcher. She looks into the effects of serotonergic psychoactive compounds, particularly ayahuasca. She did her master's here at the University of Zurich and her PhD at the Psychiatric University Hospital of Zurich. She worked with the likes of Dr. Scheidecker, Dr. Klein, and Dr. Kvednov. She combines her personal trips to South America and Africa with thorough scientific training, and her work also delves into the role of psychotherapy and contextual factors in psychedelic-assisted therapy. She is currently in the committee of the SEPT, that's the Swiss Medical Community for Psycholytic Therapy, and even more currently, she's honoring us with her presence. So give a warm round of applause for Dr. Helena Aicher.
Yeah, thank you for the warm welcome. And it's a strange room, but it's very nice to see you all. I see some people that I know and many people I don't know. So we're gonna look into ayahuasca and ayahuasca-inspired formulations. And I didn't know who will be here, so how much you know about it, how much you're into research. So I hope to address a little bit of everything, give a bit of an introduction in ayahuasca, the culture, but then also diving into the research we're doing, some geeky, nerdy stuff as well for those who are interested. And so maybe everyone finds a little bit that he or she is interested. So I hope this works. This doesn't work. So ayahuasca, that's the Amazon. The overview, as I said, background, also globalization issues, clinical potential, and the project we were involved. And then, as I said, a little bit of the ayahuasca-inspired formulations research. So what is ayahuasca? It is an ethnomedicine from the Amazon region, and it has been used by indigenous tribes for centuries, even millennia, for different purposes, rituals, spiritual healing, also things like hunting, which is often not mentioned in our view. And it has capacity to induce altered states of consciousness like other psychedelics as well. I would like to say a little bit about the word ayahuasca, because that's the word we know usually, but it has various names depending on the region, depending on the tribe. So it has names like Yahe, Oni, Natema. It really depends, and it also depends not only on the tribe or the communities, but also on the researchers, that how they interpret it, because it's a language that's not written usually, these indigenous languages, but it's only like oral So it also depends how you hear it and how you write it down afterwards. A current name is Daime, more from the church, but we will come to that later. Some of the tribes, just to give you an impression, are the Shipibo. These are is the most in number of people, the biggest tribe, but there are also others like Shuar or Kofan, Yavanava, Unikuin. And they are all like in the Amazon. They don't know the border that we know, but it's where it's green. So you have it in Brazil, Peru, Ecuador, Colombia, even in the south of Venezuela, in the north of Bolivia. It's important to understand that the use of ayahuasca is really rooted in the culture and in the tradition of these tribes. And most of them have really an animist worldview, so that everything that is has lives in a way. So it's not only humans and animals that we think live, but for them, like the world, also what we think doesn't live, for them it lives. And as I said, oral nature of the language and the tradition, so they usually don't have written words. And as I also said, it's really diverse, so you can't say this is ayahuasca or this is the original, because there are many. And sometimes they even don't agree where it comes from or how it's originally done. So even amongst or within or between tribes, they have like disagreement on how it's best cooked and how, so it's really interesting. So at the right side, you see a Shipibo artwork. And what I find very interesting about this is that for this artwork expresses somehow the language or the chants or the singing, which is called the Icaros. And it somehow represents the net that the world is made of, and it's made visible by the ritual and by the singing that the shaman receives through seeing the patterns. He also heals the client. At least that's one interpretation of how this is, what it expresses. From the botanical origin, usually ayahuasca contains the ayahuasca wine, Banisteriopsis caapi, and often it contains other plants such as chacruna or also chacropanga. Not all tribes combine it, but most of them with some sort of different plants. And then it's cooked like you see at the right side below. In terms of pharmacology, the wine, the Banisteriopsis caapi, contains beta-carbolines. Most of them are selective and reversible MAO inhibitors, like harmine or harmaline, and some are not only MAOIs, but also serotonin reuptake inhibitors. And then most tribes combine it, as I said, with another plant, one or the other that contains DMT. And this DMT is a serotonergic psychedelic, like with an activation at the 5-HT2A receptor, such as LSD or psilocybin. And this combination of the two allows the DMT to reach the brain, where it has evolves these hallucinogenic effects. So the MAO-E inhibits the degradation of the DMT. If you would only take DMT orally, then it would be degraded by enzymes, and the MAO inhibitors prevent this. So this was a little bit of pharmacology. Now on globalization and context. So as we saw, indigenous tribes have used ayahuasca for a long time. And then in the 1920s, 30s, something interesting happened, which was a clash of the Christian religions with the indigenous tribe. So there was this man, Mestre Irineo, who kind of adopted ayahuasca to the Brazilian churches. And União do Vegetal, Barquina, Santo Daime, and other churches emerged in that time. And nowadays they are spread all over the world. And we also see nowadays neo-shamanic ceremonies also in Western countries, also a little bit in Asia, but not so much like here. There's also, on the other hand, tourism towards the Amazon region, so the ayahuasca is taken away from there, but also people from here go there. And it has been recognized also in culture and also in media and also research, what we're also going to talk about. Yeah, and I think 2 or 3 years ago, we did this search on Retreat Guru, typing in ayahuasca, and we found like 307 retreats. I just looked it up yesterday, and it's 1,204 retreats. Yeah, just interesting to see. Yes, I talked a little bit about the churches, and I wanted to show you some pictures of the Mapia. It's a Santo Daime community in Brazil. And you see at the bottom right, this was the time when this center was constructed. It's really deep in the Amazon. You can look it up on Google Maps. Just nowhere, green, 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 and then you find this community. And left up, you see how it looks nowadays. That's the center where they hold the ceremonies, which you also see down there. So they're wear white clothes, and it's really a structured ritual, men and women separated, and they really have like a church service drinking ayahuasca. Yeah, it's interesting to look into that if you're curious. Now a little bit about context and safety. Some long-term studies have shown that ayahuasca used in a church setting is quite safe, minimal risks in the structured environment, and there seems to be no dependence potential. But of course, there's issues such as situational safety, also effects on pre-existing physical or mental health, and you should also keep in mind like some food and drug interactions, and maybe check your physical health before. It's also important to know that the risk is really setting specific, because usually ayahuasca is taken in very structured settings. The traditional use structures the ceremony, and there's the shaman or curandero, or however you want to call him, who manages this. He structures also the ceremony. And also the churches, as we have just seen on the picture, they really structure the ceremony. And so in Western contexts, the structure or the safety, the setting varies greatly. So it's, I guess there's high quality, but you might also find less quality around. So it's really setting dependent how safe it is. Some words about globalization and also some political risks associated with the globalization. So on the one hand, these tribes that use ayahuasca for, like in their tradition, they face the risk that their sacrament is being prohibited and criminalized. And of course, also their traditions are endangered because of globalization in general, which also is a case in ayahuasca, not only, but ayahuasca cultures also experience this. And then, there's also this sort of cultural clash often that, so the tourism there is also a chance for people and something that they can make a living. But on the other hand, it clashes a little bit with their original way of living. And it's also maybe an adaptation of the narratives around the ceremony that they do because we Westerners go there, so they also adapt what they're doing. So it's also a question of authenticity or cultural identity versus what do they represent. And of course, sometimes also social role conflicts amongst those that are maybe successful in their work with tourists and gain money, which was not like a priority, or they didn't have money before, but now these social roles become like, they just change, and this can potentially be a risk and also a chance. This is a wonderful movie that some people made. Someone is even here in the crowd. I don't see him. So if you're interested in getting an insight, I highly recommend watching this movie. yeah, so this was the risk that indigenous cultures experience, but I would also like to address a little bit the vice versa risk I see. So often what you perceive is that in the Western world we have something like idealization of indigenous cultures, or also something that you would maybe call a rejection of the own, or something like cultural pessimism against our own culture. And sometimes this also leads to inadequate containers and maybe miscommunications or false expectations. And as we grow up and we are socialized, our culture is also something that we embody, and it's important to also keep that in mind and try to integrate this a little bit. Recently or in the last few years there were many newspaper articles about also dramatic things like sexual abuse in the framework of these retreat settings or so. Also a dark side. But there are also projects that try to kind of combine the indigenous knowledge and wisdom with some Westerner perspectives. So that was a little bit about globalization and culture. Now let's get into therapeutic potential. So several studies have shown potential of ayahuasca in the treatment of so-called internalizing or affective disorders. We talk about anxiety, depression, or PTSD, and also like addiction, alcohol or drug addiction. And also some trials have addressed eating disorders. We found, for example, in this global ayahuasca project, of all the participants that reported that they had depression or anxiety when they took ayahuasca, most of them said they improved after taking ayahuasca. So this was only cross-sectional, but there were also some randomized control trials which show improvement in depression symptoms and also suicidality. And last year a study came out. I had the pleasure to review it, and they handed it in as an ayahuasca trial, but they actually worked with really analog plants. So they changed it afterwards because all the reviewers were not happy with them stating it was ayahuasca. And they showed in an observational study depression reduction after ayahuasca analog ceremonies. So over all these trials that have been made, the need for support in a psychological way seems to be accepted widely. So it's the substance, but also the surrounding that matters. Now, you saw there are different categories of mental disorders. We saw like PTSD, depression, anxiety, eating disorders, so a variety of diagnoses. So it seems to be a bit non-specific. And it has been discussed that it's not like the specific pharmacological effect that makes the whole effect of the depression or the anxiety treatment, but it seems to be more somehow underlying mechanism that the substance and the experiences modulate. And maybe as a reminder, affective disorders such as depression, they are characterized by things like impaired social functioning, relationship to oneself and also other people, and disconnection, feelings, alienation, and also impairments in self-referential processing, how I perceive myself, and so on. And often accompanied by a thought, things like rumination, and so on. And ayahuasca seems to target exactly these mechanisms. So you see just a selection of a couple of studies that have found these effects of ayahuasca. You find things like insightfulness, trust, empathy, mindfulness-related capabilities such as decentering or detachment, but also experiences like emotional breakthrough, and so on. So yeah, there seems to be kind of a match at the base of these mechanisms. So what we did a couple of years ago was setting up this global ayahuasca project. You see here the project leader, Daniel Perkins, with the aim of understanding more why people do it, in which context they do it, what their effects are, and also potential risks, and so on. This I already showed. So one paper showing these depression decreases and also anxiety. But what I was more interested in was this observation that ayahuasca is usually across context taken in relationship or community or group settings. So no matter if you look at indigenous cultures, tribes, or at the churches, or in neo-shamanic traditions, like almost all settings are community and group oriented. So I wanted to look a little bit at ayahuasca and relationships. And what I did was just doing this word cloud with all the trip reports and like their qualitative reports in the study, and you see connection, love, relationships appeared quite often. So that was interesting to just get a first idea. And then something we did was looking at life changes. So to clarify, these were self-reported life changes, cross-sectional. So they got this survey online, anonymous, and they just filled it out. So it's maybe also biased, but what they reported, just to give you an idea, an example, they reported some life changes regarding the relationship with others. So some reported ending relationships or starting or healing or also creating conflicts, and also deciding to have children or deciding to not have children. So we try to always look at both sides, and you see the percentages of people that chose the respective. So they could either tick it or not. And here you see the percentage of people that reported that this was one of the effects they felt. And I wanted also to look at how they perceived or evaluated these life changes. And you see that some people really report that these life changes were negative, but it was not so many. And many more reported that the life changes were positive. So you see the exact numbers, but I think, to get a general idea. And then to understand a little bit things that I didn't understand based on the numbers, I didn't understand why would creating a major personal rift or conflict be evaluated as positive. So what we did was looking into the reports of exactly these patients, these participants, and you can read it, or I also read it. I find it always good to also understand quantitative data by looking at qualitative data. So really diving into what the people feel. And someone, for example, he wrote or she wrote, "I've had a huge conflict with my mother because we needed to root up all traumas, and that was a sensitive, scary time. But now are sorting things out, and we have a much better and truthful connection than ever." And then another says, "The creation of new conflicts in relationships has been an excellent teacher for me, especially in the realms of learning about self-worth, personal boundaries, and that conflict can be okay and healing in its own well. It has been resolved now, but the lessons for both of us were profound." And maybe a last one, "The change ayahuasca caused in me was something my family didn't understand, and they still held on to the old perception of who I was to them. This caused a lot of pain and fighting within family dynamics. but has been an important lesson in growth and following my own heart and being true to myself as an individual. So I think just seeing the numbers wouldn't have given me any clue, but reading the reports is clarifying. But I also don't want to miss the negative effects or the negative reports, because there's also always two sides. So someone wrote that he can't even begin to describe the devastation, and someone felt that it just added confusion. And another one that was in German, so these were in all languages. So he said, or she said, there's a new conflict. With whom can I openly talk about my experiences without being stigmatized? Which I also found interesting. And to summarize, I also, being a researcher, you sometimes want to have answers and understand better. And I like this quote because someone wrote that, I understand the need to have short, simple answers in a study like this, but do remember that many changes are neither positive nor negative and do not need to have value judgments placed on them. Also very enlightening. And this is just a summary of it all. This is a very complex soul journey. Now, a little bit about the translational challenges. So in the beginning, when we started our research, we thought, ayahuasca is interesting. We want to research it and maybe make it available for patients here. But that showed to be very complicated for several reasons. On the one hand, you have physiological side effects like vomiting, and they might be a part of the healing system in the Amazon tribes, but you don't want it in the hospital here, maybe. Or maybe you want it, but the system wouldn't want it. It makes it a bit difficult. And it's also not easy to standardize, and if you want to bring a medication on the market or to the patient in the end, you need to standardize it somehow. And then something I find also important is all the cultural and sociological and environmental factors, that ayahuasca is really a worldview and a culture, and just taking it and importing it here doesn't feel right. So ayahuasca analogs, so-called, or pharmahuasca might be a potential solution to this problem. I wrote this in quotation marks because I still think the term ayahuasca analog implies that it's just an analog of the ayahuasca itself. But in fact, as we saw, ayahuasca is a whole culture, a world view, a belief system, tradition. So just calling it ayahuasca analog only because we take some of the molecules is a bit reductionist. That's why I renamed my talk and say ayahuasca-inspired formulations instead. But you would still see this term ayahuasca analogs for combinations of molecules or plants that contain the active ingredients of the original ayahuasca, but derived from other plants or even synthesized, for example. So that's the idea. Is that clear? More or less. Okay. So, some of the plant combinations that are commonly used are Peganum harmala syrinru, which is one of these MAO inhibitors, or it contains MAO inhibitors. What I found very interesting is that this has a traditional use also in Iran. So if you look into these analogs stories, you find it all over the world, or also in the Asian regions where you don't expect ayahuasca to be found so much. And a very common plant for the DMT source is Mimosa hostilis, which is also used traditionally in South America and often called Jurema. Maybe you have heard about it. Now, when we started to do that research, this were the newspaper headlines. So it doesn't actually look like this, but so they said that we are working on these ayahuasca things, analogs. What I found interesting is to find that we were certainly not the first to study pharmacology or ayahuasca analogs. So you see here a photo of a lab technician hunting a rat under pharmacology, poor rat, or I don't know, poor lab technician, one of the other, in Switzerland, 2006. And one of the pioneers in using harmaline, one of these analog compounds was Claudio Naranjo. And if you look a little bit into all these different compounds, you also find that harmine has been produced by the company Merck for different purposes, hypokinesis, rigor, and so on. So yeah, there's not so much, but there is a little bit of research already. But again, back to what we did, we tried to implement these, I still call it ayahuasca analogs, but keep in mind it's only pharmacologically an analog. So instead of Banisteriopsis capi and Psychotria viridis, we took Peganum harmana and Mimosa hostilis. Instead of cooking it like here in the Amazon, it looks a bit different in our case. Dario, our pharmacologist, did a very good job in extracting it. And that's one of the final products we used in our studies. So you see at the left side the DMT nasal spray, and on the right side buccal harmine tablets. Then you imagine that this ayahuasca brew with all the plants is very complex pharmacologically. It has these DMT and beta-carbolines, harmine, harmaline, THH, and a lot of other alkaloids. What we did was just reducing the complexity. DMT and harmine is what we're working with. And these were the newspaper headlines, and this is how it actually looks like. Some of you have seen the pictures already. I like to show it just to make sure the contrast is visible. And what we did there in the lab is a first open-label dose-finding pilot study, which was, the first paper was accepted yesterday, finally. And then we did a randomized controlled trials, testing harmine DMT versus harmine only versus placebo with 30 healthy male subjects. And we had a couple of measures for those that are studying and interested in going into research. I dive a little bit into that. For the others, I'm sorry, it's going to be a bit nerdy. Methods that we applied were physiology, blood analysis, and behavioral tasks, psychometric instruments like questionnaires. We also did interviews that we transcribed, and generally looked into potentially therapy-relevant processes. I'll start with the pharmacological data. So here, to give you an understanding of how such a day looked like, they came to the lab, and then you see down below, you see the minutes, and at t minus 30, so that's 30 minutes before the first DMT administration, they took the harmine, and then every 15 minutes we gave them DMT. So we dosed them up with a nasal spray. And for the nerds amongst you, pharmacokinetic results. Some highlights that we found that the harmine administration worked very well in this buccal administration. So you see that the harmine reached the blood. Another nice finding is that we have this smooth, maybe not plateau, but the DMT concentrations are not like a peak, but they go up and they stay a little bit and go down. So it's not so overwhelming for the participants. And for the really nerdy people amongst you, one of the nice findings are these very high 3 IAA levels, which means that harmine only partly inhibits MAO. And now I tell you why this is interesting, because when you see the metabolic roots of DMT and harmine, you see that DMT, when you add harmine, then you block the MAO, right? So it's a MAO inhibitor. But apparently, because we had 3 IAA, so high levels of these, not all the MAO was blocked. And this is interesting because some are concerned that if you give patients such drugs and they already have another drug such as an SSRI, this can cause a serotonin syndrome, because if the MAO is blocked, then it can become a problem. But apparently harmine blocks part of the MAO but not everything, which is health relevant. So that was for the nerds. I hope the others don't mind. Now back to the acute subjective experience. And those of you that are familiar with psychedelic research, you all know the 5D ASC scale. This was the experience, how they retrospectively rated it. So the experience was characterized by imagery, like these patterns and colors, but also blissful state, insightfulness, disembodiment, all these typically psychedelic aspects. And we also had some experience sampling items, so we asked them with each blood drawing, we asked them intensity from 0 to 100, liking 0 to 100, and they just gave us a number, and these are the results. So intensity goes up and down again, liking, high liking, a little bit of disliking, especially at the peak, because they had to do an experimental task, which was really not nice at the peak. But it was also interestingly arousing and relaxing at the same time. So very interesting findings that we are now analyzing a little bit more in detail. So now again, something for the experimental psychologists among you, a task that we developed to understand this so-called effective self-other overlap. So you see this self-other overlap, there's these circles that have been used to assess how people feel. And our hypothesis was that in placebo you don't feel such a self-other overlap, but then in DMT harmine you would feel a big self-other overlap. And how we measured, or we tried to measure this, was with a reinforcement learning task. So they had to learn symbols and they would get a positive or a negative feedback. And then you can measure in the brain the response to that feedback. And you can imagine if you are learning for yourself and you get the negative feedback, you actually lose money. Then the brain processes these feedback because you will lose money. And it has been shown that if you feel empathetic or close to someone, then it hurts you as much if it's the loss of someone else, like it hurts you when it's the loss for you. But if you don't care about the other person, the response in the brain is lower. Does it make sense for the psychologist? Or so we wanted to show this in the brain, having these event-related potentials. And because research is also about failures, we didn't find it. But we found some other interesting results, like general reduction of the event-related potential amplitudes. And what we found in the behavior, because they had to learn, right? So you could also, we could also look at the learning rate or the correct answer ratio. And what you see here is that in the placebo condition, they learned much better for themselves than for another person. And in harmine and DMT, there was no difference. So this goes into the direction that we hypothesized. So you learn better for yourself in placebo than you would learn for another person. And in DMT, Harmine, the difference between you and the other person disappears, and you learn equally well. Is this clear? We'll get to more general again later. Another that I don't want to keep for myself because it was very funny. We did a karaoke task. So we pre-recorded their singing. They had to sing. And in the substance day, they heard themselves singing, they heard another person singing, and they heard the original voice singing. And then we measured their embarrassment and some other things. And of course, the idea was that they would feel more self-compassionate under DMT Harmine, so that they would not feel so embarrassed. And this is what happened. So they felt less embarrassed in the DMT and Harmine condition overall, and the difference between self and other was lower in the DMT Harmine condition. But sadly, which is a bit a limitation of that study, they also rated the objective quality as better in the DMT Harmine condition. So maybe they just didn't realize how bad it was. Yeah. So now something maybe not so technical anymore. We also looked at the measures of dreamlike states and primary process cognition in the transcripts of the interviews. So I told you we also did interviews. We analyzed them, and we found that the reports were characterized by a type of experience that was more dreamlike. So there are measures to code text according to dreamlike or not. And so they seem to experience more like lower level, automatic, motivation driven, more direct, or in the terms of Freud, more primary process cognition compared to secondary process cognition, which would already be something meta or processed. So this is one of the qualitative reports results that we found. And we also found post-acute effects on mindfulness and compassion, but no lasting effects. And we also found that the effects on mindfulness depended on the sensitivity to the drug. So if they had high intensity ratings, they also had higher mindfulness effects afterwards. Like other ayahuasca trials that I showed in the beginning, we also found things like psychological insights that were stronger in DMT and Harmine, and also stronger in Harmine compared to placebo. So there we even found effects of Harmine, where we didn't find Harmine effects in most other measures. And then we asked them in the follow-up, like 1 and 4 month follow-up, about their persisting effects, and they reported mainly positive persisting effects. And then we adapted significance ratings that Roland Griffiths, maybe some of you know him, he was a very well-known, influential psychedelic researcher who died, I think, last week, and he really was an inspirational figure. And so we adopted his measures of significance, and I found it interesting that it was 7 people of our participants that said that the experience was amongst the 5 most personally meaningful experiences of their life. And these were all high responders. And 2 people said it was not more than an everyday life experience. And these were both low responders. Now you have seen many numbers. And for me, it's always important to keep in mind that it's all like it's participants and numbers, but it's people that go through experiences. Now, another study that we just finished some weeks ago, we did another dose-finding study in a group setting with 16 healthy subjects, and they came 6 times and got different doses again, so we were not so happy with the first dose finding, but we developed the substance further and also the administration forms, and we tested this again, and with a group of 16 participants in a group setting. And you see here, Joël and Clemens are the main PhD students of the project. This is the study setting, and there was a documentary recently. They came to visit us in the lab and did this documentary. So you get a little bit of an insight in how that looked like. So every participant lying on the mattress. So one was missing at that day. They were always a group of 4 people. So everyone had a sitter next to them. Then what we also did this year was a meditation study in the beautiful Felsentor. This is a monastery in the Swiss mountains on the Rigi. So it was the second study that happened there. The first was a psilocybin study. There was also a beautiful film that came out, also documenting that previous psilocybin trial. But now we were there with Pharmacology or DMT harmine. And it was 40 people, male and female, with experience in meditation. It was also randomized controlled trial, so some people had placebo, unfortunately. They came for a 3 days meditation retreat. We also did fMRI and psychometric and phenomenological assessments. Now you see this very beautiful space, and as a contrast, I also want to show you a little bit how the fMRI scenery looks like. So when you read about these beautiful studies, it's also very technical behind. Then Clemens also did a rat study. Unfortunately, that's part of the game. And he just published it recently. And what we found most interesting was that he did not find significant occupancy at the 5-HT2A receptor. Why ever? Because this is supposed to be really the main driver of hallucinogenic effects of all serotonergic drugs. Of course, you have null findings, false negative, false positive, that happens in research, but we find this really considerable, that there was not an occupancy at these receptors ex vivo. And we certainly have to look into that more deeply, because the whole receptor thing seems to be much more complex than we often think. Now, what's next? Jasmine is, together with the whole team, preparing a 5-MeO-DMT study. Just today we got the ethics approval to finally start. On pain perception with 5-MeO-DMT. And Clemens is doing a human PET study. And they are both looking for participants. And also, if someone is already at that state, we are also looking for 2 PhD students starting next year. And a little bit of an outlook. So Emilia and Jonas are leading the PsyFit study. It would be with a Y and not an I, sorry, on leadership and resilience. That's going to start next year or 2025, not sure yet. And hopefully next year we finally start with patients. And I would also like to do some studies explicitly for psychedelics in women. So as a summary, I think we agree that human beings have used plant-induced psychedelic altered states of consciousness since centuries or millennia around the globe, and really in many cultures. And there's a diversity of communities using ayahuasca. There are different worldviews and different traditions. And as we have seen, there's a globalization of the brew and also coming with consequences. And we see a context-dependent potential of ayahuasca to treat mental health disorders and beyond. So again, it's complex, and I think the most important is really interdisciplinary research and the dialogue. So interdisciplinary is the keyword because we have a really cool team with psychologists, pharmacologists, and chemists, and medical doctors, and health science, and cognitive scientists, and so on. So it's not everyone on this slide, but many, and yeah, such research can only be done in a good team. So yeah, thanks for being here. And with that, I would like to thank you all. So that's also a quote of one of the participants, and I just quote him, and yeah, give it further, and thank you all for coming. Yeah. So maybe if you're interested in becoming a participant or becoming a PhD student, it's the address below. And if it's things that you want to address to me personally, then it's the address above. Yeah.
All right, we're open for some questions and maybe even some answers. If you have a question, raise your hand and somebody will come to you with a microphone, and then you can go ahead and ask your question.
You were mentioning in slide 4 that in the original cookbook of ayahuasca there were some serotonin reuptake inhibitors.
Serotonin
Reuptake inhibitors.
In the composition of ayahuasca?
Yeah.
Yes, like THH, for example.
Yeah, and so in your experiment you didn't put any of this serotonin reuptake?
No, like it was only the harmine. We just took this. I mean, it has a variety. I can show it to you. So it also, harmine also works on different receptors. So that's a good question actually, because we believe that it's not only making DMT work, it doesn't only prevent the degradation of the DMT, but it somehow in the combination has effects that DMT alone, IV, wouldn't have. So this is really something to look more into it. But yeah, it was only harmine that we used.
Okay. Because like you mentioned also on the rat, like when we did the IRI, there was no occupancy of the 5-HT2A. And I was wondering if it could have an impact to add this reuptake, this serotonin reuptake inhibitor on top of the DMT and the harmine.
So, sorry.
Like on the slide with the rats,
yeah.
Like you were mentioning, you didn't find any like occupancy of the 5-HT2I receptors, just with the harmine and the DMT, right?
Yeah.
And I was wondering if by adding some serotonin reuptake inhibitors, you can maybe like.
Yeah, that would be interesting to look into. But the interesting thing is that like overall, there's like this. Everyone thinks that the 5-HT2A receptor agonistic properties of these psychedelics are responsible for the hallucinogenic effects, and you see them with our preparation also in people. So people report that they have psychedelic effects, but in rats we find no occupancy at this receptor. So that's still doesn't solve it.
Yeah.
But we could try to add something. That's true.
Yeah. Thank you.
Batterie med.
So you have mentioned some of the benefits of your new ayahuasca-like drug in comparison to traditional ayahuasca. But how does it compare to other traditional psychedelicals like psilocybin and LSD? I think those don't have some of the disadvantages like standardization and making you nauseous.
Yeah, that's a good question. So I think we experienced that this, like, on the one hand you have LSD which lasts a long time, and then in the case of DMT harmine, you have a very short half-life, and you can like still dose it up so it doesn't produce this habituation like psilocybin or LSD do. So you can pre-dose with harmine and then you can go up with DMT. And the effects that participants often respond or report are like empathogenic, but also psychedelic. So it has a strong empathogenic component, which maybe LSD and psilocybin sometimes have, but not that much, at least for some participants. And then you can also dose up, which means you don't have to give the full dose at once, which can be overwhelming, but you can give a little bit and a little bit and a little bit. And for many patients, that might be an advantage because they have some sort of control. And then you have the short half-life, so if they stop taking it, it just goes back very quickly. And this is an advantage, I think, for some patients.
Can you not also do that with psilocybin, like dosing it up?
Yeah, but the half-life is much longer, so if you take a dose, then it lasts much longer until you're back to baseline again. And also, like, in terms of phenomenology, I think really this quality of empathogenic and psychedelic, I think there's something to it. Of course, we don't fully understand, and we need many more patients. But it's, slight differences also in the experience.
Okay, thank you.
Thanks.
Yes, I have a question as well. You mentioned the cultural differences and the cultural pessimism in our culture in some points, and the integration of the cultural pessimism, but I was not sure what you meant with it.
Maybe not so much the integration of the pessimism, but the integration, like some people say, like, or some people seek healing in other cultures and in other worldviews, and like energy healing, or also like the shamans there do. But I think as the way we are socialized, we also have a sense of psychology. We also have, and I think it's important to also integrate the psychological things. So one thing is to like have like bad energies, and you can maybe heal them, and that's valid. But it's, in my experience, also important to look at what's maybe psychologically going on. So is there a reference point of the bad energy there, maybe to my development or my patterns or my relationships? So integrating the sense.
Okay, do you meant the integration in the look at the situation or at the circumstances, and not the integration into the trip itself?
No. Integration, I think. I think, of course, the priming, the way you think, also shapes the way you experience something. So maybe we can't avoid that our upbringing, our culture also influences, shapes a little bit the way we perceive things.
Yeah, that makes sense. Thanks.
Thank you for your talk. My question is about the set and setting.
Where?
Sorry?
Oh,
yeah.
Okay, sorry.
My question is about the set and setting, and you mentioned bringing the analogs or bringing those pieces into the lab. But I wonder if you can talk a little bit about how much or how you're integrating some of the ceremonial components. And my understanding is that in ayahuasca ceremonies, often the doses are lower. I know that's certainly the case in peyote ceremonies. And yet the setting, the ceremony, the protocols are actually more important and produce some of those effects. And I wonder if you can talk about how you're doing that in the lab setting.
Yeah, very interesting. Just one short excursus. What I heard is that since Westerners come and drink ayahuasca, the ratios between DMT and harmine have often been changed with more DMT, and the original tribes usually have higher levels of the vibe. So in terms of ritual, I mean, yeah, it's a good question. I mean, you saw our setting. We try to provide care, provide safety, provide some sort of preparation, and also some like limited amount of integration. We don't have like a program, so we reduce it a little bit, but you saw that we try to make it comfortable. We have some flowers. So there's some sort of already ritual, because that's already a ritual, even though we might not be aware of it, but having like a center, carpet in the middle and some flowers, these are ritualistic elements in a way, and they give safety, so the people come and they know the space, and this already makes something. On the other hand, we also like try, yeah, it's a bit difficult. I think it's unethical not to provide all the support that is needed there and then. But for example, we try not to impose too much of a worldview or explain things as we think they are. So we try to keep it open for the interpretation or ask questions also. But a good question. Did that answer the question? More or less. Okay.
I have a question about like the experiment with the mice. I'm not sure if I've missed that, but you said there was like not the reaction in the brain that you expected, but did you notice like some like change in behavior or things like that? Like you assume like that they didn't have an effect, or like that they didn't feel anything, or like that the feeling of, or like the psychedelic experience is not like caused as you thought?
So I didn't assume anything about if they felt or not, but just that the occupancy wasn't there. I mean, there are some indicators how you can see if these animals experience something. I would have to actually ask Clemens because I wasn't there. But as far as I understood it, it was not that we, like, they might have experienced something, but not with the receptor occupancy that we expected. Yeah.
Hi. So I didn't get really what's the aim of the research, because I really think there is a big potential in the ayahuasca healing properties, and so of the traditional preparation. At the beginning you talked also about like eating disorders and trauma elaboration and things like this. And during the study, the results that you showed, I mean, maybe I missed it, but it was more about how much they felt and the intensity, and so yeah.
Yeah, so I can elaborate a little bit on that. So there's like different sides on it. So on the one hand, we try to also develop, or there's a company that tries to develop a medication that's hopefully going to be available for patients. And we run through these studies, and what you always do is you have preclinical studies in animals, then you have phase 1 studies about safety and tolerability. And for example, the group study, let me see, the group study that we did, that was a phase 1 study where we really took the blood of the people, we measured all the safety relevant data. So that's one thing, we somehow try to make it available for patients. And that's also where the clinical trials with patients come in next year. But then there's also like pure scientific interest and curiosity. So some of the tasks and things that we measure are just to understand it better, just to understand how does it work. And a little bit also the thing that I showed you with the circle, with the processes. So also address some of the potentially underlying processes that make the substance potentially work. So understand, is it more the empathy, is it the self-compassion, how do they relate, and how are they characterized in the brain, in the experience. So understanding the underlying mechanism.
And you talk about the medicament. Which kind of ailment?
Which
for
kind?
Yeah, for which ailment is the medicament for?
Yeah, that's in discussion at the moment. So many different factors play into that decision. So it will be something of that spectrum that ayahuasca might have been tested on already, or other substances. So things that you can think of is anxiety and depression and these things. But for drug development, so many factors play into the game. So the final decision for the first study isn't done yet. But you have to define like an indication that you test the drug on, and then you can still develop from there. Yeah.
Okay. Hi, thanks for the talk. I was wondering, from your experience, your clinical experience, your therapeutic experience, how would you describe or put in words the therapeutic potential?
Very good question. I really hope that this comes on the market soon, because sometimes we have patients that have the application for MDMA, and then you can change to LSD or psilocybin, but you can't combine them. And I really think some patients will profit from this combination of the psychedelic and the empathogenic. And my gut feeling is that the DMT harming combination could be a remedy for that. Or just combining MDMA and LSD, but that's being tested right now and we can't do it yet. So I think that's just a thought. Yeah.
Maybe one last question before we leave you all out in the upper row.
Hi, thank you for your talk. From what I understood, you're trying to understand these molecules, what they do, but why not work with indigenous cultures who have maybe another view but gained a lot of knowledge of all those years, because it's an old medicine.
Yeah, that's true. I mean, you can do it all. That's just what we do, and we think everything is somehow necessary. So there are people that work there in the Amazon. Sometimes I also feel their way of doing research or understanding the world or knowledge is also very different. So you can also try to communicate and understanding how they perceive it, as I said. So they also work with energies and malojo, and like they work differently, and I think that's valid, but it's just something different than we do. And we are communicating also with, like, there's another thing, like there's the drug development, but there's also a foundation that tries to get into the dialogue with the indigenous and understand also what they need to, but it's just different pieces of the puzzle. Yeah. Maybe I still want to answer a little bit more on that setting question that was raised before. I think it's valid to say that participants really appreciated the setting, and I think it hugely impacts, or it hugely modulates the way they rate their experience, because the way that the setting is created, of course, influences the way that an experience is made. But I see really an ethical dilemma there, because you can't take away that care and support. So how would you test this? It would just be unethical. And at least the blood levels, we hope, are not modulated by how they felt. But it's really a good question. So I think that was it, right?
Okay, then join us again in thanking Dr. Helena Aicher for this very, very, very nice talk. So before we all let you go out in the uproar, we want to make a quick advertisement for our next talk. It will be on the 12th of December. It will be by Matthias Forsman. He works here at the University of Zurich. I think Helena also cited him in her talk. And his talk will be about mindscapes and landscapes, what we can learn from psychedelics, and how psychedelics maybe can enhance our awareness for the environment and whatnot. So yeah, note the date. It will be a very interesting talk. It will be in the same room as the last two talks were here in the main building in the Call F 101. If you scan the QR code, you will get to our Instagram page, which you should absolutely follow. So you stay tuned for every other talk that we organize. And yeah, I think that's all. So you can head out in the uproar, talk together, build some new networks. And yeah, thank you all for coming.